Let's get an update from Dr. Rivers.
In the last 3 weeks, case numbers have continued to grow exponentially. We now have an estimated 4.2 million cases and 240,000 deaths. Almost every country is now reporting cases, and those who aren't may simply not have the resources to conduct surveillance. We don't see any change in the rate of rapid spread, and models estimate that we could have more than 12 million cases and close to 1 million deaths by mid-January. We're not sure how big this could get, but there's no end in sight. Financial markets are universally down by 15% or more on the year. Fear of a catastrophic pandemic and uncertainty about the capacity for governments to respond and remain viable are fueling investor uncertainty.
Okay, for more on this, we're going to get a briefing from our communications expert, Dr. Sell.
Global health experts have highlighted that dis and misinformation are wreaking havoc on the CAP's response. Health workers are under attack in a number of locations due to rumors that they are purposely spreading the disease. And response efforts in many places have had to be suspended because of concerns around violence. Pharmaceutical companies are being accused of introducing the CAPS virus so they can make money on drugs and vaccines, and have seen public faith in their products plummet. Unrest due to false rumors and divisive messaging is rising and is exacerbating spread of the disease as levels of trust fall and people stop cooperating with response efforts. This is a massive problem, one that threatens governments and trusted institutions. Polls have shown that mis and disinformation are ubiquitous. At least 90% of the public has been exposed to these messages. At the same time, misinformation messages come from a variety of sources, even government officials. And often governments are contradicting one another. We know that social media is now the primary way that many people get their news. So interruptions to these platforms could curb the spread of misinformation, but could also limit access to information from legitimate sources. Health ministries around the world are attempting to combat mis and disinformation by amplifying public health messaging through social and traditional media. But they are being outpaced by false and misleading information. National governments are considering or have already implemented a range of interventions to combat misinformation. Some governments have taken control of national access to the internet. Others are censoring websites and social media content. And a small number have shut down internet access completely to prevent the spread of misinformation. Penalties have been put in place for spreading harmful falsehoods, including arrests. Other countries have taken a more moderate approach and have focused on promoting fact-checking efforts and working with traditional media outlets, yet these approaches are limited in scope. Social media companies report that they're doing all they can to limit the use of their platforms for nefarious or misleading purposes. But this is a technically difficult problem, and false, misleading, or half-true information is difficult to sort without limiting potentially true messages. The bottom line is that members of the public no longer know who to trust. Both the misinformation and the measures to control it have led to a crisis of confidence.
Thank you, Dr. Sell.